Hi ladies, and I'm here just giving an update on my mental health. Um, Anyone who is watching this video who haven't watched any of my other videos, I have my window open. I live on a busy street. You're going to hear the noise. So, and besides that, I'm laying in my bed right by the window. And I just like to let you know in case it's a little bit too noisy for you. Well, I've still been going to my therapist ever since my video that I posted about Can I Talk to You If You, which I will link in the description box below. So anyone who hasn't seen that and seen this video first, you can go back to that one. Like I said, I've been going to see a counselor since the 8th of July, and I go to her once a week, usually on a Thursday. And today is September 14th, and it took a while to see the psychotherapist because he just was booked or whatever. But I finally seen him today, and I must say that I was very, very nervous and anxious. I don't know, I mean, I have anxiety issues already, but it's just like, I guess I was just anticipating what he was going to say or whatever. But so I went back there and talked to him. It didn't last no more than 15 minutes, the whole thing. He just basically went over what my therapist wrote down, and just told me to give like a brief just give me some brief history of what's been going on with me and all that stuff. I don't know, like, I don't want to freak anyone out, and if you're curious about anything or you want me to do more videos on it because you're curious and you don't want to look it up, but it's pretty much already all over the internet. Besides having the what I was diagnosed with PTSD, ADD, that's a whole nother thing. They just think I have it, which I looked at the symptoms and they're probably right. They're usually right about these things. So the PTSD, anxiety, depression, all that, ever since I can remember, I was 5 years old, and I'm not trying to freak anyone out. Like, it's legit. Like, I'm not the only one, and for a long time I thought I was the only one suffering from this. But it's a group on Facebook for this. It's YouTube, people on YouTube talk about it. I didn't see very much videos on it, but you can Wikipedia it. It's like for real. But if you look up sleep paralysis, I've been dealing with that since I was about 5. 5 is the furthest back I can remember. It's pretty much being asleep and can't move in, but the scary part is there's like you see like these shadow figures, and it's pretty much sitting on your chest and choking you basically, and there's nothing you can do. Like, you can't even form words or to scream out for help. You just deal with it. My husband, like, our first year of living together, he noticed like my eyes just darting across, just like moving really fast, and that's REM. That's rapid eye movement. I have rapid eye movement when I'm going through these spells or whatever, and it's a very, very scary thing, a very terrifying thing, because it's not only like the thing is sitting on you, choking you, it rapes you, like, for real. Like, you're legit feeling that you're thinking you're getting raped. I mean, look it up. Like, I know some people are like, what the hell is this girl talking about? Just before you judge or criticize or try to make someone feel bad about something you don't understand, do research. I mean, the blessing and the curse is the internet. So That's my advice. If you don't understand something, just look it up. I will forewarn you though that it is scary. Imagine having to live with it. Like every time you close your eyes, this is what I go through. And I was got to the point where I'm hearing the voices, but it's only when I'm asleep. When I'm going through these night terrors, it's almost like a deep voice, but it's also like somebody talking into the fan at the same time. Like if you ever talked into your fan, it sounds like that. That only happened maybe once or twice though, but it was scary. Other things dealing with it is just, I mean, you never could see the figure. I mean, you can see like the shadow, but you can never see like a face. Like I couldn't tell you what it looked like because it's just basically a dark shadow and it's like ghostly. And then just imagine being paralyzed. You can't move, and you just have to take somebody choking you. I don't know how else to explain it. Some people are worser. Like some people have worse spells than even what I have. But it's nothing like just being envious of someone who can get a decent night sleep. So besides my husband has watched me have these spells before, and I'm gonna try to record it and see what happens. I'm gonna try to set up a camera one day and record me going through one of these spells and upload it just to see. But my husband said it's basically me and my eyes are just starting across or whatever, and like a whimpering sound, like I'm trying to talk but I can't. And when he hears me whimpering, he wakes me up because he knows I'm having one of those spells. But I wanted to tell y'all before I go, I didn't want to go too deep into that. Like I said, it's way deeper than what I'm just touching the surface. But I went and seen the psychotherapist, and he basically, in a nutshell, told me that there's no help for sleep paralysis. All I can try to do is to give me something that puts me in a deep sleep so my mind isn't racing so much, because my mind legit races for like 2 hours before I even fall asleep. I just be thinking the weirdest things, and then that crap pops in my head, like the worry of it happening and all that. So I can't I haven't had a decent night's sleep in so long. I can't even remember. So for that, I don't want to show you my information, but if you can try to show you, it's Trazodone, and it's 100 milligrams of this. And what this is supposed to do is to put me in a deep sleep. I can go and look on my phone and tell you, because I want to look it up too. But this is what the pill looks like. That's what it looks like. And he's gonna make me take these for 30 days, which is a month. And I go back to see him in November the 2nd, and then we go from there. But it's supposed to make me sleep, and it's supposed to also help with anxiety and depression. And then let's see, I'm gonna try right quick and just, because I kind of like, I'm sharing this with you guys, but at the same time I'm documenting this for myself so I can see like if it's affecting me in any way, negatively, positively. Should I keep taking it? Should I try something else? So it's basically like just what I'm just documenting it. But all comments are welcome. If you took this before, knew anyone taking this, have any suggestions, anything, just leave it below. It says used to treat depression. The drug can cause serious side effects. Let's see. Side effects that you should report to your doctor or healthcare professional as soon as possible. Allergic reactions like skin rash, swelling, face, lip, tongue, fast, irregular heartbeat, feeling faint or lightheaded, painful erections or other sexual dysfunction, suicidal thoughts or other mood changes, trembling. These are the usual. These are the ones that do not require, medical constipation, headache, muscle aches, pains, nausea, vomiting, usually weak or tired. Okay, just give me a list of what not to take, what other medications not to take while on this. I'm not taking any other medications anyway, and I don't plan on to. I don't drink, I don't smoke, so there's no worries there. I'm supposed to take it 1 hour before I go to sleep. So, but like I said, my mind races. But I usually lay down to go to bed at like 10 o'clock, so I'll take it at 10. And I will definitely keep doing little videos just to see what is it doing to me. So when I do go back to see him, I can give him accurate information, or so I don't miss anything or whatever. Patients and their families should watch out for new or worsening thoughts of suicide or depression. Also watch out for sudden changes in feelings, such as feeling anxious, agitated, panicky, irritable, hostile, aggressive, impulsive, severely restless, overly excited, and hyperactivity, or not being able to sleep. If this happens, especially at the beginning of treatment or after a change in dose, call your healthcare professional. Okay. May cause dry eyes, blurred vision. Mouth might get dry. Chewing sugarless gum, sucking hard candy, and drinking plenty of water may help. So, like I said, I've never, I know that medications isn't the cure-all and all that, but I'm willing to see if anything helped me at this point, because dealing with this sleep paralysis stuff is honestly draining and scary, and there's nothing I can do about it besides maybe get put in a deeper sleep. That's about it. It's just something that I'm going to forever deal with, basically, and that sucks. Like, you guys who can fall asleep like my husband, 1 minute he can talk to me and the next he's asleep. I'm so jealous. Like, ugh. I'm like, yeah, rub it in. Look at you thinking you are awesome with your easy to fall asleep ass, and I'm here fighting in my sleep trying not to get the living hell choked out of me. Hopefully this does something. Now we on to the other. They gave me another medication. It's cover bloop, and okay. This is the second and the last medication that I'm on here today. And this is Lexapro. It's a Lexapro, generic for Lexapro. I can't pronounce that one, so it's Lexapro. And it's 10 milligrams. Sorry if you can't see me, but it's 10 milligrams. And I actually went on YouTube and looked this one up, and I'm kind of scared. Why? Because first, let me tell you, that my doctor told me to take half of one of these today and the other half of it tomorrow. I guess to get my body ready for it or whatever. Here's the other half. I took half today. And this is also to help with depression and anxiety. But from what I read, this is not good reviews at all. If you look up Lexapro, Lexapro, the few people I watched, I was like, oh, I'm kind of scared, honestly. And then it's even like look up Lexapro withdrawal. Like what? I'm scared. Like I already don't. I probably shouldn't have looked at that, but I'm the type of person before I take anything, I don't care what it is. I have to I instantly grab my phone and look it up. And WebMD, I'm looking at the side effects. I'm looking at what it's supposed to do and all, what it's not supposed to do. Whatever. That's just the type of person I am. And this whole withdrawal talk and that just got me spooked. But it just doesn't have good reviews. But let's go ahead and open this back up to WebMD, and I'm going to share a few things with you about it. I'm on it now. I started my first half today, and that's been about 4 o'clock, and it's now 6:41, and I feel okay. I feel a little jittery, if anything. Like my hand's been shaking a little bit ever since I took it. But that's about it. And this is just day 1. So we're gonna see what the next month brings. Like I'm spooked. I'm not even lying. I'm spooked. I'm really scared. Lexapro is an antidepressant belonging to a group of drugs called selective serotonin. I can't even. It's SSRIs. It's a chemical in the brain that may become imbalanced and cause depression or anxiety. Lexapro is used to treat anxiety in adults. Lexapro is also used to treat major depressive disorder in adults. And Lexapro may also be used for a purpose not listed in this medication guide. Okay. Let's see. They're just giving information on not buying it from internet sites or nothing like that. Come on. Take Lexapro exactly as prescribed by your doctor. Take it each time. Try to take Lexapro at the same time each day. It may take up to 4 weeks or longer before your symptoms improve. Keep using it as directed. Do not stop using Lexapro suddenly, or you could have unpleasant withdrawal symptoms. See, Lexapro may impair your thinking or reactions. Be careful if you drive or do anything that requires you to be alert. It may cause blurred vision, tunnel vision, eye pain, swelling, or seeing halos around lights, nausea, vomiting, diarrhea, loss of appetite, feeling unsteady, loss of coordination, racing thoughts. I already got that issue. Unusual risk taking behavior, feeling extreme happiness or sadness. I wouldn't mind having a extreme feeling of happiness. I'll take that side effect. I'll take that side effect and be happy. Severe nervous system reaction, very stiff, rigid muscles, high fever, sweating, confusion. I'm already confused. Fast or even heartbeats. Tumors. Oh, I was about to freak out. Tremors. Feel like you might pass out. Woo! Drowsiness, tired feeling, sleep problems, insomnia, vision changes, mouth nausea, gas, heartburn, upset stomach, constipation, weight changes, decreased sex drive. Alright, this pill pretty much sounds like a big, it sounds like this is gonna be hell in the bottle. I'm just gonna give it the month, as recommended by the doctor, and we should go from there. I've been rambling for 21 minutes. Oh, I'm sorry. But yeah, I just wanted to give y'all a update. Like, I went today, got the pills, and we're gonna see what happens. The videos when I talk about this should be getting smaller. It shouldn't be longer. I mean, can't think. Shorter. But I also read that, well, I watched the video and somebody said when they was going through withdrawals that they had brain zaps, and it was basically like a feeling of electricity, like jolting to different parts of their brain, sometimes to their nose, or they can feel the electricity jolt through their tongue. I am freaking out. I should have not watched that, but curiosity, I swear. Oh, well, we're gonna see, and not everything's the same for everybody. So what may work for me may not work for them, and vice versa. So I'm going in with an open mind and hoping for the best here, even though right now I'm getting like a slight headache. But yeah, thanks to anyone who's taking the time out to watch this video and follow me along this journey in my life to a happy girl, hopefully, or more stable girl. We shall see. But yeah, bye.